want to welcome you to this video, and it's titled Telemental Health Counseling 101. In this video, there's several learning objectives that we want to cover. First of all, we want to define telemental health counseling and get a better understanding of what this term means, and to get a better understanding of how we are to use it as we're working with clients. Also, we want to talk about the different types of telemental health counseling that are out there. Since this is a growing practice and it's a growing part of our field, we want to look and see what are different ways that we can provide services through telemental health counseling. We also want to look at the effectiveness of telemental health counseling as well. And so we're going to review a couple articles that talk about how it is being used in the field. Also, we'll look at some potential concerns people may have that may bring them into counseling that telemental health counseling can help as well. Also, some myths of internet-based counseling. We want to cover those, and also the advantages and disadvantages of telemental health counseling. Although this article came out in October of 2011, I feel like what it encapsulates here still something that's very important for us to be considering today as we begin this topic and begin this video. And so I do want to read this to you to give you a better understanding of kind of how we're setting the pace for today. It reads this way. It says, the relationships between people on Facebook who don't know each other or on Twitter are real. If we can't wrap our minds around how those are real, then we'll have a hard time establishing a genuine relationship with the client or understanding them. It doesn't mean they're good or bad relationships, but they're real. And basically what Lynn Shallcross was trying to get across in this article here is that for us, whenever we see individuals who are connecting on social media, we see an emotional connection they have because the relationships they have are real, even though they don't see each other face to face all the time. And so you may see someone who has a multitude of individuals who they call friends or people who they are connections with. There is a relationship they have there that does maybe not look like a traditional relationship that we consider traditional, but it's still a real relationship. And so it's important for us, if we're going to be practicing telemental health counseling, that we have to realize that as we're connecting with people in an online environment or using technology as we're doing that we have to make sure to realize that these are real relationships. That I still have to work hard on building rapport with that client. I still have to pick up on social cues and things of that nature and treat this like a real relationship. And if we do that from the beginning and to keep our mind kind of wrapped around that this is a real relationship, this is something that's really happening in real life, I think it will help us to better serve our clients. And so I just want to cover that a little bit here at the beginning to kind of set the pace for where we're going today. Next, we want to define the term telemental health counseling. The reason why we want to do this is because there are so many different terms out there for telemental health counseling. I remember probably maybe 10 years ago when a lot of individuals first started talking about this, the term Skype therapy came up, or online counseling, different things like that. And there were so many different terminologies that are out there that it got confusing for people to know what exactly they are doing or whenever they're doing a telemental health counseling. And so what we're trying to do now is trying to get one term that is recognizable across the field, in the mental health field specifically, so that we know exactly what terminology we can use. That way it's something that the public can pick up on and start using in the right way, and we as professionals can start looking at it the same way. And so we want to define this as the use of telecommunication technology to provide behavioral health services. And that's what we're basically doing with this. Now, like I said, there's different names. There's technology-assisted counseling. There's online counseling. There's video therapy, telecounseling, internet counseling. All these different types is there. The problem with this is if you're doing research in this area, or if you're trying to talk to a professional in another state about this, it can get very confusing because, once again, everyone uses different terminologies when it comes to this. So it's important for us to realize that for us to have one centralized terminology to use, and that's why we said we want to use the term telemental health counseling throughout this training. Next, we want to talk about types of telemental health counseling, and there's two main types that we're going to talk about, and then some subtypes up under that. The two main types, the first one is called synchronous methods. And this is counseling that involves the client and the therapist at the same time. And so I think an easy way to remember that is think of synchronous swimming, where they're swimming together. In this type of counseling, once again, the client and the therapist are there at the exact same time, even though the modality in which they reach out could look a little different. So video-based counseling, for example, that's going to be synchronous because I'm seeing their face, they're live with me, and we're able to connect with each other that way. Or chat-based or messenger-based counseling. We're both on there at a specific time period to answer questions, and so we're in sync with each other as we're communicating. Also text-based. Well, once again, we've set up a specific time for our counseling that we're doing, and so we know that what the other person is saying because we're in sync with them as our communication is going back and forth. And also telephone counseling as well, or telephone-based counseling, because once again, we're on the phone with them at that time. And so because of this, we call these synchronous methods because we're doing it at the same time. The other one is what we call asynchronous methods. And this is counseling that does not involve the client and the therapist at the same time. And there's two different ways of doing that. One will be email-based. If you've been on social media recently, you'll see there's several different companies out there that are advertising for email-based therapy. I'm not a big fan of that, but that's just kind of where I sit with that. But at the same time, some people still practice in that way. And with this email-based therapy, the therapist will send out an email to the client asking a few questions. The client will email back, and you have this back and forth exchange between the therapist and the client. One of the issues I have with that is just, once again, knowing making sure there's some type of policy set up to know how often the client expects to hear from you. Once again, verifying the client, different things of that nature. Those become some issues we see with that, but people do still practice in that way. And the same thing with text-based counseling. Once again, just not knowing when that person is going to respond back to you, and then dealing with a crisis. When you have asynchronous methods, dealing with the crisis, it almost becomes impossible for that. So for the purpose of this training and for this video, we're going to be spending our time focusing on synchronous methods. Even though there are therapists out there who practice asynchronous methods, we want to focus on synchronous methods throughout this video. Next, we want to talk about the effectiveness of telemental health counseling. One of the big things we always talk about in mental health is looking at evidence-based practice, that we want to work towards that with whatever modality we're doing. And it's important for us that more and more research comes out on telemental health counseling, especially on the effectiveness of this type of counseling. Because when we don't have that done, if we don't have the effectiveness part down, then it's kind of hard for us to promote what we're doing. Because if I can't prove to somebody that the things or the methodology that I'm using is actually working, then it's going to be a hard time for me to find people to work with in that modality. And so we want to look at a few articles to talk about the effectiveness of telemental health counseling and see the difference that telemental health counseling makes when compared to traditional face-to-face counseling. And so if this is a study that came out of the University of Zurich. This is a University of Zurich study divided a group of 62 patients in half and found that depression was eased in 53% of those given online therapy compared to 50% who had in-person counseling. 3 months after completing the study, 57% of online patients showed no signs of depression compared to 42% with conventional therapy. And that came out of a Journal of Affective Disorders in 2013. And I think that's an amazing number there at the 3-month mark, that almost 60% of those individuals show no sign of depression at all, where almost 40% of them still had some signs of depression as compared to 42% who did conventional therapy. And so I think that's a significant difference that we see there, that telemental health counseling is showing, at least in this study, that it is effective, if not more effective, than traditional therapy. Now, as we go through these studies I'm going to talk about, the purpose of telemental health counseling is not necessary to replace traditional or conventional therapy. I think there will always be a place for conventional therapy. There will always be a place for the clients who will be looking for that. But I do want to present this telemental health counseling as a way, as an alternative method to add to a practice that you're doing, and also to reach a different population of people who may be looking for something a little bit different. Next, there's in a 4-year Johns Hopkins study that included close to 100,000 veterans, the number of days that patients were hospitalized dropped by 25%. They chose online counseling. This is slightly higher than the number of hospital visits experienced by patients who use face-to-face counseling. So once again, we see here that online therapy significantly lowered the number of hospital visits among veterans in the study that is done here. And so once again, just kind of giving us an example that there is something behind what's going on in telemental health counseling, that it is being effective. Also, we see that 500 patients in Ontario, Canada were assigned to face-to-face or live video counseling and experienced statistically the same clinical outcome and level of patient satisfaction. The only difference was that the cost of providing the online service was 10% less per patient. And that's a 2007 article from the APA. And I think that's a neat place to look at, that this Canadian study is showing that online therapy delivered the same satisfaction, but did it at less cost. And I know for anybody that's in mental health, that when we think about the cost of mental health counseling, if we can bring that down, and that's going to be helpful for our clients, going to be helpful for us as well as clinicians, and we can bring down the cost of what it costs to deliver services. And so once again, telemental health counseling is one of those things we're saying that it can be effective, and these studies are showing that there is some effectiveness behind it. And also, there's a pilot study compared the effectiveness of online cognitive behavioral therapy and in-person supportive therapy in 45 defense service members suffering from PTSD after the September 11th attack. After 8 weeks, those receiving online therapy showed greater improvement. 6 months after the first meeting, those who had received online therapy continued to show improvement, in direct contrast to the in-person group. And so what this is saying is that online therapy may be an effective way to provide PTSD treatment to a large group of people. And so once again, we're seeing these articles as echoing this ideology that telemental health counseling is something that is valid, that it can be effective with populations of people. Once again, we're not trying to replace traditional counseling, but we think this is a good way, an effective way of being able to provide services for individuals who may not be able to get services at all. Next, we just want to talk about a few random facts, or telemental health counseling random facts. First of all, there's over 10 million Google hits in less than a second when searching for online counseling. And that's, to me, is an important thing, that this is a topic that is obviously growing in popularity, that when people are looking for counseling, a lot of individuals are looking for places to go. And not everyone is wanting to go into a traditional counseling setting. And so once again, this is a growing practice that we see that will continue to be more and more relevant as time goes on. Also, we're seeing that psychiatrists and speech and language pathologists have already accepted the practice of telehealth with their clients. There are many psychiatrists throughout the United States who are already using telemental health services to be able to connect with their clients. I know even in my local town, we have a psychiatrist who is here who works with children, and they use their video service to cover about half the state because of the shortage of psychiatrists in this area. And so that's just once again a way of showing that because services can be limited in some areas, it's good to be able to have individuals who can practice in an online environment. And one thing we're also seeing is in the individuals requesting help through online counseling, 68% have never been in therapy before. I think that's pretty significant. That when we look at the individuals who want to do online, if almost 70% of them have never been in therapy before, that's helping us to see there's still some stigma with coming into a counseling office. So now that stigma can be dealt with through the use of telemental health counseling. And so I think these random facts, I think they kind of help us to once again see this is a good practice for us to be considering and to be investing in as well. Next, we want to look at what we call potential clientele concerns. These may be some concerns your clients may come to the table with in order for them for us to consider if they're appropriate for counseling services through telemental health, or some things that can actually benefit them if they want to choose telemental health. And so one question we want to ask is, how might the person's computer skills, knowledge, platform, and internet access affect the therapy? That as I'm working with a client, if they're not very good at using the computer, or if they're in an area where they're still using dial-up, because there's still places in the United States where we have that, or if they're not really good at using certain counseling platforms or video platforms or whatever the case may be, then the question may be, will that affect therapy? And if we're saying yes, then that may be a consideration for us to say, this may not be the best person for us to work with because of their computer skills and some issues we're looking at when it comes to their knowledge of online therapy or telemental health counseling. Another thing is, how knowledgeable is a person about online communication and relationships? Is this person expecting this to be a 24-hour-a-day thing? Are they expecting that they can connect with you any time of the day? What is their viewpoint on online communication? So obviously we have to make sure we're setting up some good boundaries with them for telemental health counseling. But once again, being able to screen for clients and make sure that they know how to communicate in the right way and what this professional relationship looks like. Also, availability of services within a geographical area. This is one of the main reasons why we see telemental health counseling growing, because there's still a lot of areas where there are shortages of mental health professionals. And so because of that, we see more and more people who are going and using telemental health, whether it's video-based or another synchronous-based way to do it, to be able to connect with people because they don't have any place else to go. And so whether it's through because of someone's insurance provider, there's no one in that area, or they're just made to be in a place where there's just not many mental health professionals whatsoever, this broadens people's availability to work with people in many other geographical areas. I live in a state that's very rural, and because of that, we do have a somewhat of a shortage of counselors in certain areas. And so this is just another way for me to be able to connect with clients throughout my state because now my state boundaries, at least within outside my state, distance is not an issue for me because I can connect with them through video services if I choose to do so in that manner. Also, the perceived need for anonymity. Some people, once again, still do not want to walk into a counseling office or a traditional counseling office. And so whether it's because they are a mental health professional themselves, maybe they find themselves in a high-profile job, or maybe they just simply just don't want to come into a counseling office. Some people want to remain as anonymous as possible. And so for them to be able to receive counseling services from the privacy of their own home may be a great thing for them to be able to consider because it may not be another way for them. It could be another issue for them where once again they may be a therapist in that area and they still want to be able to once again get the therapy but not sure where to go to. So this opens up for them the opportunity to get the therapy they need, and so that perceived need for anonymity is important. Also, lack of transportation. I worked in community mental health for a long time, and one of the issues that came up constantly was the lack of transportation. That some individuals were not able to get into counseling because they didn't have a way to get there. And so now with telemental health counseling, we can kind of cut that out. That they may not have the ability to be able to, if they don't have the transportation to get in, now that's no longer an excuse that can be used because they can still jump online or the phone to be able to provide services that way. Also with the weather, when weather comes up and there's inclement weather, some people still need to be able to meet with their therapist, and this still provides another way for them to connect because that lack of transportation may be there and I can still connect with them. Another thing is convenience. Now, some people don't like that terminology. They don't like the fact that, well, why we make it, convenience is not always what it's always cracked up to be. Well, there's nothing wrong with something being convenient. Maybe someone just simply doesn't want to come in, and this is more convenient for them to be able to do it online. I don't think there's any issue with that whatsoever for it to be a lot more convenient for the client. If this helps me to build rapport with them because my services are a lot more convenient than another therapist in the area, then I think that's not necessarily a bad thing whatsoever. And so I think convenience is something to consider as well. Also, cost. We looked at one of the articles earlier that talked about how cost can be a factor that it can make it a more affordable for people to be able to do this because the overhead goes down. And so I know some people who practice telemental health counseling directly from their home. They have an office in their home, a room that's dedicated just towards therapy. And because of that, they're able to have low overhead. They don't have to rent office space or anything like that. And that helps them to be able to have their fees at a certain rate where they still can make a livable wage, but also be able to provide services to a wider population of people. And so cost, once again, could be a factor to consider. and also the age of the client, just considering that. I know personally, I don't work with children under a certain age doing telemental health counseling. And so some people will look at age as being a factor when considering telemental health counseling is most appropriate. For me, when I work with children, I like to be right there with them, face to face, be able to be in the same room with them, be able to be in the same room with their parents. That's just a preference of mine. And so for me, I don't use this with a certain age groups of people. And it's just because I think in some of them that face-to-face environment is more important for me. But each therapist is going to have their own preference for that. But I think age could be a potential client concern for us to consider. Next, we will look at 10 myths of internet-based counseling. One of the first ones is that online therapy is impossible. There is still I would say a sizable group of individuals in the mental health field who think that online therapy is impossible. They just still cannot wrap their mind around the fact that we can do therapy through video or phone or whatever the case may be. And so they're afraid of technology. And so, and my rebuttal for this from all the time is that it is possible because it's happening. I've seen some great therapists doing it. I'm seeing great results from it. I'm hearing clients giving great feedback about it. And so, online therapy or telemental health therapy is it is possible. It's been going on for a long time. It's interesting. We've had crisis hotline, like phone hotlines, for years, and no one's ever questioned that. But when we start talking about online therapy, that's where people get a little bit leery about it. But I think it is possible because we've seen great results from it. Some people think that online therapy consists almost exclusively of email exchanges. Obviously, that's not true. Now, we've talked about some of the different synchronous and asynchronous methods that you can use. And so some people do use email, but you can use a lot more of the stuff besides just email to connect with a client. Some people say text only is inadequate to convey a richness of human experience. Well, once again, that may not be necessarily true. That for some people, they may be able, if they're using some type of messenger to get across and to connect with somebody, this may be an easier way for them to connect. There is this term called the disinhibition effect. And basically what that means is that people feel a lot more comfortable talking about things in an online environment because they feel like there's less judgment will happen to them, or they feel like there'll be less judgment be placed upon them. And so sometimes through the use of text only, they're able to get out adequately what they're feeling about things, because some people are better writers than they are talkers. So imagine that. And so they can get out for their emotions and be able to connect in that way. And so for that may be a way for them to be able to share themselves in a counseling session. Next, some people will say that suicide prevention and crisis intervention are impossible online. I don't think this is impossible. I think that this is made a little bit more difficult. That if you have the right type of crisis intervention protocol set up for your practice, then it will not be difficult for you to deal with suicide prevention or crisis intervention. It just has to be something that you have to be diligent about and making sure you do everything you can to set it up beforehand before the crisis actually occurs. I think the worst way to deal with any type of crisis is to wait until after it happens. So if you prepare beforehand, then you should be fine. Also, effective online counseling for serious disorders is not possible. Once again, we know that not to be true. We've seen there's articles out there on depression, PTSD, anxiety, several different serious diagnoses that people are dealing with, and we're seeing that telemental health therapy is effective in all these areas. And so you can deal with some very severe issues through the use of telemental health counseling. I think the biggest issue is being able to screen for the right type of clients so that you can make sure that you're giving the right and effective type of services. Another thing is some people say that geography does not matter when providing mental health services online. Once again, this is definitely a myth. There are many individuals out there who will go through a training like this or go research this topic like this, and they think because they went through been through a training, that now it's okay for them to start counseling across state lines. Well, there's obviously some issues with that. There's been several studies that have been put out there about looking at the ethics of this, and what we're seeing over and over again is that states want you to be licensed in the state state where you are, and also where your client is as well. And that's been a general rule for most people. So, for example, I'm licensed in multiple states. So because of that, I could be able to counsel across state lines as long as those states were, I'm licensed in those states, and those states were okay with telemental health counseling. But geography does matter when providing mental health services online, and so we have to make sure we check with our ethics boards and the counseling law. That way, we can make sure we're practicing in the right fashion. Also, as this online clinical work always involves one counselor or therapist working with individuals in group. Well, the reality is you can actually do a multitude of things with technology, with telemental health counseling. You could have a thing where you can provide a group counseling environment and do that with actually a couple of different therapists, if that's the way you run groups. I can see you doing marital sessions where you're running with two therapists at the same time. And so I think you have a lot of flexibility in the online environment, just like you do in the on-ground environment as well. Some people say the online principles are the same as offline principles. And once again, this is a myth. The reality is that just because you're good at being and knowing the principles and ethics of counseling on ground and traditional setting, does that mean you practice the exact same way? Because it's different. There's some things that you have to know that are different about doing telemental health counseling that would not apply to traditional counseling. And so the principles are that they do change depending on the modality that you're using. And also, some people say that online training and peer supervision are ineffective. There are several articles out there that talks about online training experiences and peer supervision and the effectiveness of that in the online environment. I know many individuals who are actually trained in telemental health counseling. They've done that in an online environment before, or they've received all their training online, or actually been trained as a therapist in an online environment. And so we see that supervision is done through telemental health as well. And so the reality is that you can get great training and peer supervision in an online environment, once again, if the supervisor does it in the right manner and is trained properly in that manner. And finally, any clinician experienced in face-to-face work can do online work. And this is obviously not true. There are some people, just like in teaching, there are some people who are really good at teaching face-to-face who are horrible online. And there are other people who are excellent online teachers, and they're horrible when it comes to face-to-face work. And so the same thing goes to technology, to telemental health counseling, that just because you're good at one does not necessarily mean you'll be good at the other. And so it's a competency I think you have to kind of grow in order to be able to get better in this modality of therapy. Next, we will look at some of the advantages and disadvantages of telemental health counseling. I think as a part of informed consent for us as therapists, it's good for us to understand what are some good things about telemental health counseling and what are some things we need to consider that could be considered disadvantages as well. First of all, we have access of services to underserved population. One thing I'm seeing quite a bit of is that because of telemental health counseling, people who traditionally did not get therapy now are able to do it. I've seen community-based mental health centers now are able to get into jails a lot easier because there's a less risk of anybody getting hurt, and now because of telemental health counseling, they're able to provide services in jail settings that they were not able to do it before. Or for people who are on call, we see clinical mental health places where they're also using they maybe have a local clinic, and they'll bring the client we brought into the clinic, and the on-call person can actually do the video stuff from their home or from a local clinic. That way, the drive time is cut down significantly, and they're able to connect with the client a lot quicker that way. I've heard of another instance where there is a school for the deaf and blind, and within that scenario, this person was a counselor, and that during the school year, all the kids would come to that school, and they would get their counseling service through the school that year. But then when summer hit, the kids would go home for the summer, and that therapist would literally have to drive to all these individuals' home. But because of telemental health counseling, they were able to provide services to their students throughout the summer in an online environment instead of them having to drive, and so it saved them a lot of time that way. And so we're seeing that a lot more underserved populations are now able to access counseling because of telemental health. Another thing is just the flexibility of time. There are individuals who like to have sessions at night, which I think can be a great thing if you're able to do that. But some people may not want to be able to want to get out at night to do that, and so it may be flexible for them to be able to jump into an online session late at night or first thing in the morning, depending on their schedule. And because they have that flexibility of time, the drive time is now gone. They don't have to worry about being late for the session, and so some of those time constraints that we normally are used to now go away because of the use of telemental health counseling. Also, it does not have to occur in real time. Depending on the way you do it, sometimes with some of the asynchronous methods, those are not done in real time. And sometimes individuals will use email-based therapy to, once again, to connect with their clients, or text-based as well. Even though I have issues with that, once again, it doesn't have to be in real time. And so it is a viable way of doing it, even though there may be some additional concerns with that. But it doesn't have to occur in real time. And so that may be beneficial for someone who may be a client who is not in crisis mode, who may be more in a maintenance mode. And so it may be a situation where they're able to connect with the client that way and not do it in real time and still get them the support they need. Also, decreased client defensiveness due to perceived anonymity. And we talked about that a little bit already about the disinhibition effect. It's just because now that because of this disinhibition effect, and because I feel a little bit more anonymous, my defensiveness has gone down. And so once again, I may say things to you in this online environment that would maybe not necessarily say face to face. And if you've ever been on social media, you will notice that there are individuals on social media who will put just about anything on there that you probably wonder, why would they put that on there? I think they're feeling that disinhibition effect. They feel free, and their defensiveness is down, and they'll say things there they wouldn't normally say to this person's face. And so we're able to get sometimes a lot further with telemental health counseling because defensiveness has gone down instantly with many of these clients. Also, the privacy leads to less counseling-related stigma. When I know that I can have privacy and be able to meet with a client, as a client, if I know I can have privacy and meet with a therapist, this for me gives me a lot less stigma for counseling. I'm going to be a lot more inclined to sign up to do therapy at that point because, once again, I'm not feeling judged. I don't feel like this is something I have to hide from anyone because I can do it in my own home. And so that privacy factor, even though they're utilizing the privacy factor, they're still getting the help that they need. And so hopefully the more and more people who do this, the stigma that's attached to counseling will go away. And also the ease of documenting sessions. A lot of people who do telemental health, some of them will record their video sessions, obviously with the permission of their clients. There's several electronic health records out there that are very helpful when it comes to documenting sessions and things of that nature. And so this way of doing it becomes a lot easier than a traditional counseling setting that you may find yourself in. And some other advantages is increased popularity of social networks is driving more people to be more comfortable with communicating online. It seems like everyone is online now. Even your grandmother is probably online at this point because it's popular for people to be on social media. We're used to connecting with people in an online environment, and that's what the beginning of this, as we began this training, it talked about that. Is that because people are so used to being online for everything else, the idea of doing online therapy is really not far-fetched for them. And so this is one of those things where we see telemental health counseling growing significantly because people are just used to being online for just about everything already. Also, just the increased flexibility of services. I'm able to provide some more additional services because I'm not, once again, locked into an office anymore. Also lower costs for practitioner and to the client. Depending on the software that you use, you can do telemental health counseling pretty inexpensively, and because of that, it helps me where I can actually offer lower prices to my clients, and gives me more access to more people that way. And also the availability of a wide variety of online support groups. There are many support groups online right now, and telemental health counseling makes that possible. And so, for whether it's a support group for grief and loss, or whatever the case may be, or a parental support group for parents of children with autism, whatever the case may be, we see that there's a more opportunity for people to be able to find the support they need. But distance could have been an issue before, but no longer is it an issue because they can connect online. So there are definitely several advantages to telemental health counseling. Next, we're going to talk about a few disadvantages of telemental health counseling. One of them is the difficulty of determining the qualifications of online therapists. For individuals who are trying to find counseling online, one of the problems is when they go and they Google online counseling or telemental health counseling. Remember how you said up to 10 million hits? Well, you can get that in under a second. And so with all these hits coming up and all these different people showing up that says they do telemental health counseling, it's hard for individuals to know who actually has their qualifications to do that. That's why it's important to make sure that we are providing on our websites how we've been trained, where our license is, how to verify our license, different things like that, so that people know exactly how I am qualified to do telemental health counseling. Also, there's problems in ensuring confidentiality of sensitive information disclosed in online counseling sessions. The reality of the counseling profession in general is the word privacy. That comes up quite a bit. The reality is that there really is no such thing as privacy anymore. And I'm not trying to be negative by saying that, but we know that from many different articles we've seen, from things we've seen in the news, that our government sometimes does listen in on to certain conversations and things of that nature. And so because of that, we really don't have privacy. And so whether it's in an on-ground environment or it's an online environment, we cannot always 100% ensure confidentiality of everything. So what we can do is to find HIPAA secure methods to be able to connect with people. We use encrypted methods as well, but we still have to remind people that even because we're in an online environment, it still is possible for somebody to get into their information. Is it more difficult than on ground? Yes. Someone has to have a great skills to be able to hack into some of the softwares that packages that you can use for telemental health counseling. But the reality of it is it's still possible. And since it's still possible, we have to let people know of that possibility. Also, the lack of spontaneity. Sometimes in my own ground sessions, if I want to get up and walk around with the client or do some other things with them in session, I may not be able to do that in an online environment because we're not in the exact same room with each other. And so that sometimes that lack of spontaneity can go away because of us using the online environment. Also, the danger that online counseling may increase the likelihood of internet addiction. We're seeing more and more people who do have internet addiction that they're dealing with. And so if they are coming to counseling for internet addiction, then it may not be helpful for them to be a part of telemental health counseling. They may want to go into a more traditional counseling setting. And so we want to make sure that what we're doing as counselors is not enabling or harming people in the long run. And also the need for basic computer literacy skills and access to computer hardware, software, and an internet connection. We are still in an age where not everyone still has access to computer and strong internet services. And so because of that, if you have to have those things, then in order to provide services for a client, then it may be a situation where it may be better for them to be in a traditional setting for therapy services. And also the possibility of sudden unexpected termination of therapy due to technological difficulties experienced with a counselor or client. One of the things that is guaranteed with technology is that it will not always work. That is a guarantee. Some things work perfectly each time, and sometimes you can do everything you know how to do and it's not going to work correctly. So we have to be aware of that. The technology is going to take a day off sometimes. The internet's not going to work the way we want it to, and so we have to have ways and to be prepared for that. And also the difficulty in dealing with client emergencies that may arise. Dealing with crisis and client emergencies does become more difficult in an online environment. Once again, it's not impossible. It's not a task that we can't overcome, but it does become more difficult. And since it is more difficult, we have to be able to come up with a great plan on how to deal with crisis in an online environment. Also, limited access to nonverbal cues. When a client comes into my conventional counseling session with me, I'm able to see their entire body. I can see if they have a nervous foot that's tapping on the floor. I can see all their body language. And I end up losing some of that in an online environment. If I'm using video, then I'm only seeing half of their face, basically, or I'm not half their face, half of their body, and so I'm not able to see everything. Or if I'm using phone, I'm not able to see them at all, so I do end up losing some of those nonverbal cues. And so this is just a reality of telemental health counseling that we have to be aware of. And also difficulty verifying client identity. And we talked a little bit earlier about those asynchronous methods, and this is why I'm the most leery about the asynchronous methods, because the difficulty of verifying if that person you're talking to is the one you're supposed to be talking to. And so it's important for us to make sure we go through some type of process to be able to verify the identity of the person that we're dealing with. That way we know that we're not giving out private health information to the wrong person, and that we're actually connecting with the right person. Well, I hope this video has been a good primer for you to help you to get a better basic understanding of telemental health counseling. I know we've talked about a few of the studies on effectiveness. We talked about some of the advantages and disadvantages, but the whole purpose of this is to kind of get your mind in the mode of seeing that telemental health counseling is something that has been working well for a while. It's something that will continue to grow, but also being aware of some of the shortcomings that can happen due to using telemental health.